How do I interpret my home sleep apnea test results? Have you recently taken a home sleep apnea test and are now staring at the results, wondering what they mean? You're not alone. Understanding these results is key to managing your sleep health. The first thing to look for is the Apnea-Hypopnea Index, often referred to as AHI. This number tells you how many times your breathing stopped or slowed down while you slept. If your AHI is less than 5, congratulations. This means you have no sleep apnea. An AHI between 5 and 15 indicates mild sleep apnea. If your AHI falls between 15 and 30, that suggests moderate sleep apnea. An AHI greater than 30 indicates severe sleep apnea. Sometimes, you might see a similar measure called the Respiratory Event Index, or REI. This index might be calculated using the total time you recorded, which could lead to a lower estimate of your condition. Next, your results will specify the type of apnea detected. Obstructive sleep apnea is the most common type, caused by a blockage in your airway. Central sleep apnea occurs when your brain fails to send the right signals to breathe. Mixed or complex apnea is a combination of both types. Your report may also include oxygen saturation levels. Normal levels are typically above 95%. If your levels drop below 90%, that could be concerning. The report will categorize these drops as mild, moderate, or severe based on how low they go and how often they happen. Another important detail is your heart rate during sleep. A normal resting heart rate is between 60 and 100 beats per minute. If your heart rate shows significant changes, it may indicate stress from breathing issues. Additionally, the report might mention how much time you spent sleeping on your back. Apnea events can worsen when you sleep in this position. Keep in mind that home sleep apnea tests measure fewer factors than in lab sleep studies. They might not capture brain waves or sleep stages, which can lead to an underestimation of severity. However, they are still effective for diagnosing obstructive sleep apnea and guiding treatment options. Once you have a grasp on your AHI, apnea type, oxygen saturation, and heart rate data, it's time to discuss your results with your healthcare provider. They can help you determine the best treatment options, which may include lifestyle changes, using a continuous positive airway pressure device, or oral appliances. Interpreting your home sleep apnea test results involves checking your AHI or REI, identifying the type of apnea, reviewing oxygen saturation levels, considering heart rate patterns, and understanding that home tests provide a useful but sometimes less detailed picture than in lab studies. This knowledge will help you and your healthcare provider make informed decisions about managing your sleep apnea effectively.